How about swelling in legs? Is that also a symptom that we should consider?
Swelling in leg can be first symptom of heart failure. We need to evaluate her accordingly. Then some kidney diseases also can have swelling in legs. Simple anemia, low hemoglobin levels also cause swelling in the body.
Many Indian women are always very low on hemoglobin, right? So how do we really know about this?
Yeah, only just fatigue or some tiredness or some uneasiness also we need to check complete blood picture and see, because women, especially younger age women who are, most of them they have a lot of bleeding during the monthly menstrual cycle. So anemia is a commonest cause, and elderly patients also, because of nutritional deficiency, iron deficiency, anemia is very common in Indian women. So we need to evaluate and supplement iron and treat them properly. So when a woman has heart disease, anemia also precipitates heart problem.
Yeah. So doctor, sometimes there are cold sweats without any physical activity. Is it also something that we should be little agile about?
Sweating also is one of the unusual symptom of heart problem. But women who are in the age of perimenopausal age, they may have cold sweats as a perimenopausal syndrome. So that we need to evaluate. It depends on whether the patient also has shortness of breath, whether she has pain in chest, other symptoms also we need to correlate. And the age, if she presents in the perimenopausal age, along with sweating, there is a lot of anxiety, uneasiness, generalized weakness, so we need to evaluate her accordingly.
So doctor, like I would say many women during their pregnancy they put on weight because they're also eating for two, and post pregnancy it becomes very difficult for them to get rid of the weight, which also leads to certain heart issues. What do you say about that, and how do we avoid it?
So specific heart issue which we come across in a patient who is pregnant or who is about to deliver or post delivery also is an entity called peripartum cardiomyopathy. So here from the period of third trimester to 5 to 6 months post delivery, they can have symptoms of heart failure. They develop shortness of breath, swelling in the foot, put on weight.
Yeah.
So if you evaluate and do 2D echo in these patients, you will find that their heart as a pump is failed. There is a lot of decreased contractility of the heart muscle. So this is heart failure. So heart failure presenting during this period, peripartum period, is called peripartum cardiomyopathy. So there the muscle becomes weak, the heart chamber dilates, the left ventricle dilates, and they present into heart failure. So sometimes the heart failure is very severe. They have to admit, hospitalize, and then stabilize. We give medicines for decongestion, and sometimes it is life-threatening also. So it is usually more than 50% of such women, they improve, they recover from the heart failure, and the left ventricle function becomes normal over a period of time. But 10 to 15% of patients, they remain in heart failure and severe LV dysfunction for longer period or lifelong. So this entity we need to keep in mind and treat them accordingly and detect.
So this issue can become a lifelong threat also?
For few, 1/3 of patients, the LV dysfunctions remains as it is. Most of them they recover over a period of time, 6 months to 1 year. So
but during that, still careful.
During that time we need to control their heart failure symptoms and treat accordingly. Mainly this also is related to hormones. There is a hormone
and it's also related with age. Is it like if you get pregnant maybe much later in life, and
elderly ladies who get pregnant, it is seen common, and if she gets this problem in the first pregnancy, there are high chances, and then second pregnancy it will be more severe.
Yes.
So any woman having such problem, we ask them to avoid pregnancies because it is life threatening for her. Yeah. So peripartum cardiomyopathy we need to detect and treat them properly.
So doctor, if women want to protect her heart, so one change that she should do without fail.
So start taking care of heart by going for preventive heart checkups. So even if a woman has no complaints, no symptoms, after the age of 30-35 years, she should undergo preventive heart checkups. all our hospitals and our clinics, they have comprehensive special packages for a woman's health. So they can take those packages at least once in a year, which includes blood test, ECG, 2D echo, treadmill test. And we have in our hospitals women's wellness clinics, wherein we, cardiologist, physician, gynecologist, dietitian, they all evaluate the woman and then give proper advice so that we don't miss the disease in early stage.
So early detection is always
Early
the best.
detection is the prevention. Yeah.
So, doctor, does a woman's heart also have some influences of their mother or grandmother or aunts on their health also?
Yeah, definitely. If a woman has grandparents who is having heart disease, the chances of her having heart disease is more. Similarly, PCODs run in family, and diseases like carcinoma, breasts are known to run in family. So family history is very important. When you evaluate a woman for all such kind of diseases, we need to ask for their family history and evaluate accordingly.
Okay. So women heart attack and men heart attack, is it different or is it similar in symptoms?
So in symptoms, if you ask, as I already told you, the symptoms are very atypical. They may not have pain, the typical anginal pain which the men have. So we need to evaluate and keep high suspicion of heart attacks in them. Second thing is, women, especially Indian women, they have smaller sized coronary arteries, that is arteries supplying the heart muscle. So they tend to block easily, and then they tend to have diffuse coronary artery disease. Diffuse means long segment disease and small branches, that is microvascular disease is very common in women. And the complication rates, the risks are also high as compared to men. And the outcomes, if you treat them, the outcomes are also not good in women as compared to men. So the heart attacks in women are they are different entity, and we need to treat them properly, because especially diabetic women with short stature or thin built women, they have very diffuse disease. Multiple arteries are blocked.
Yeah.
So it becomes difficult to.
Others, usually women think that if they're thin, then their heart is good or they're healthy.
It's otherwise, coronary arteries, thin vessels are not good for
Yes.
treating.
So, doctor, one message that you would like to give for healthy women heart?
So as we were discussing, the heart disease in women are subtle and silent. So I advise women, especially Indian women, to take care of their heart like they take care of their family. So that is very important.
Yes.
We should not miss the diagnosis. We should not ignore the prevalence of heart disease in women, and that is my message.